Our first verified physician's order, check the chart for any significant findings such as allergies to local anesthetic, anticoagulant therapy, oxygen concentrations, if the person had a negative result for the modified Allen test. I will now gather my necessary equipment, which is my ABG kit, gloves, chuck, and the biohazard sharp container. I will now wash my hands for at least 15 seconds, apply my gloves. Hi, my name is Tanika. I'm from Respiratory Care. May I please have your name and date of birth? Okay. So today I'm just going to be drawing your blood today. It's an ABG, arterial blood gas. So I'm just going to draw blood directly from your artery. Okay? Is that okay with you? Okay. I will now assemble and prepare my equipment. I have the biohazard bag, the label. I have my gauze. I have my Band-Aid. I have my alcohol pad. I have my heparinized syringe plus the needle. I will now remove the cap, and I would put the needle onto the syringe, and I will put it for from 0.5 ml to 1 ml. I will now palpate. Okay. And I will now perform the modified Allen's test. I'll put my hand over the radial and ulnar artery, and I'll ask him to make a tight fist, okay? And I will now remove my hand off the ulnar artery, and I will ask him to open his hands. If there was no perfusion within 10 seconds, then that means that there was that it was a negative result for the modified Allen's test. Okay. I will now ask the patient, can you please put your arm up, and I'm going to apply the chuck and optimize the patient's position of the artery. And I will hyperextend the patient's wrists. I will now repalpate, and I will apply a 2-inch barrier and allow it to dry, and I would disinfect my hand. I will now repalpate, and I will put my hand in the patient's I will remove the cap, and I will put my hands in the patient's arm and the syringe at a 45-degree angle. I will now move my finger and go in. You're gonna feel a pinch, okay? And go in. I would slowly advance the needle to see if there's a flash of blood, but if there's no flash of blood, then I would go to the I would go just below the surface of the skin, and I will repalpate again to find the surface of the the pulse, and I will now redirect. So when I'm going to redirect, I'm going to move my hand. I'm going to redirect. Where I'm redirecting, I found the artery, and I'm going to go back in. Okay. So now that I'm done, I would apply pressure, cap the needle, and I'll apply pressure for 5 minutes. But if the patient was on anticoagulant, then I would sharp container, remove the needle, put it in, and I remove any unnecessary air bubbles. And then I will recap it, and I will mix the blood with the heparin. And then I would put it in the biohazard bag, and I would put on the label patient's name, time, the doctor, the FiO2, the temperature, the room, and where I took the blood from. I will now, if it's before 30 minutes, I would take it straight to the lab, but 31 to 60 minutes, I would have to put it on ice. After 60 minutes, I would have to throw it away and get another ABG blood sample. I will now clean up my mess, wash my hands for at least 15 seconds, and document a patient's chart.